So if you have questions about GLP-1s or weight loss, because like I said, you do not have to do a GLP-1 agonist. You do not. I help people all the time with workout plans and diet plans and just getting overall healthy and what that looks like for them. Everybody has different goals. So you do not have to have the weight loss medication.
No.
You do not. But I do offer it. And I hate that it has a stigma around it, but that's because it's been done wrong. If it is done right, it is a very safe and effective tool.
Super safe.
Yeah.
And very effective.
Yeah. Hey, I'm Jessica Goins. I'm a nurse practitioner and owner of OptimLife Health in Dallas, North Carolina. And I'm here with my husband, Bradley Goins, and together we own Goins Strong Fitness, and we have 2 locations, one in Dallas and one in Cherryville. So today we kind of want to talk to you about our medical weight loss service that we offer at OptimLife and how that works. So basically, it is an all-inclusive program, I would say, as far as
one-stop shop.
We don't want you to come just to throw you on a medication that you are stuck on. That's not the goal. The goal is for you to come in, you tell me about your lifestyle, like, what's going on, how do you normally eat, what kind of work do you do, all these things, right? What else do you have going on? Do you have underlying health issues that we don't know about yet? Have you had recent blood work? So I offer, to look at that blood, like let's say you just had it done. I will offer to look at that.
Sure.
And add to it. And then to see if I can find any underlying things that is like, ooh, that could be hindering you from your weight loss. At that point, it's like, okay, how much weight do you have to lose? What's your goals? How's your mindset toward food? Do you struggle with binge eating? Is there something, really that you struggle with?
Psychological.
So in that point, it's like, okay, do you need a GLP-1 or don't you? Because I've done this for years before I was a nurse practitioner and could write a prescription for a GLP-1, right? So if I was in that same mode where I'm not a nurse practitioner, I would certainly say, yes, absolutely. With proper nutrition and moving your body with, strategic things, you can lose weight. But the caveat is before, I couldn't see what your hormones were doing. Because we know that can
It makes a big difference.
Drastically hold you back.
If your hormones are jacked up, you're fighting an uphill battle. Doesn't mean you can't lose weight.
Right.
But if you have thyroid issues and you have hormonal issues, especially as you get older, especially premenopausal, menopausal women, men who have very low T, poor sleep patterns, stuff like that, that's going to affect your ability to lose weight.
So we decide, do you want the GLP-1?
Yes. Yeah,
which one, because we offer, a few of them. And so then we talk about it, right? The goal is, like I just said, not to put them on it, to keep them on it. I had a doctor look at me dead in the face and say, GLP-1s are for life.
They're not.
I don't care what that study showed. It's a lie. People in the regular healthcare setting who are prescribed these GLP-1s, unless they have somebody telling them specifically how to eat, not just the words, typing it in their review, their little my chart blurb. Oh, your labs look good, but you need to just eat healthier till you have somebody telling you how and what to eat and what to do, right?
They don't tell you how to eat
right.
healthy.
So,
eat healthier. What does that mean?
Yeah. So the studies on these people who they're saying are these GLP-1s are for life are on people who are not getting the proper education about food. So of course,
they're not trying to change their habits.
So if you take these medications at high doses, it's going to increase your chances, of symptoms, right? But it's
Negative
also going to
effects.
make it to the point where you're not eating, and that's why you're losing weight.
Which is not sustainable.
Right. So at that point, it is lifelong. Because guess what? As soon as you come off of it, you didn't learn how to eat, and now you're hungry, and you're going to eat the way you ate before, and you're just going to gain the weight back. So in that case, it would be lifelong.
Because that's drug dependency.
Right.
That's not using it as a tool. It's drug dependency.
Right. So our goal is teach you how to eat.
Right.
What food choices work best for you? Not me, you. There's still rules.
Yes.
Calories, protein, like all
Get
that.
the protein in,
we,
calories.
we work that out, but we're teaching you. We are using the lowest, most effective dose possible, right?
Right.
We're staying on that lowest dose as long as we can.
Because if you do everything else right, that's all you need.
Because it's not a crutch, it's a tool. It is a tool. I have a lot of patients who suffer from either stress eating or binge eating or just having like habits. Like, I mean, I had some bad habits before.
Sure.
So, especially like semaglutide, it can help on the mind.
Yeah.
What all have we seen?
Yeah, so semaglutide, for people who don't, is Ozempic and Wegovy, name brand, but semaglutide is the generic name. But yeah, it has, it's a GLP-1, it's a pure GLP-1. It's only,
That's all it is.
It's all just a GLP-1 agonist. And so it's interacting with GLP-1 receptors that are also in the brain. And so it's being studied for addiction management and stuff like that. It will eventually, in my mind, we have seen people
Yes. Who don't even want to drink.
who they want to cut back on alcohol.
Yes.
They don't want their alcohol. They don't look at food the same way. And that's on the lowest dose. Now, not everybody has that reaction, but a lot of women have that reaction.
Right.
And that is huge. So that means that it makes it easier. So the goal should be take the lowest dose and start to rebuild your habits, because now psychologically, it's a performance enhancing drug.
Yeah.
That's what it is. It's a performance enhancing drug. It's helping you psychologically manage the diet that you're trying to follow,
right,
and build new habits. So that's going to allow you to revamp your habits and change, so that if you ever come off the drug, now you have new habits in place that the drug allowed you to put into place, and you didn't struggle with the binge.
And you can lose the weight in the process.
Right.
Whereas,
And
like,
then you
if
can
you
keep it off.
if you didn't and you kept struggling and binging, you're not going to ever get it off.
And if you do everything that you're doing, where you're getting everybody's diet right, helping them get their diet right, and replace those habits, they're not having to titrate that dose up to the freaking highest dose.
I won't even do that.
Yeah.
Just so you know, I don't do.
Well, you've seen the
highest
side
dose.
effects of that in the hospital.
I used to work for gastroenterology, and we would treat pancreatitis, and that is one of the rare side effects. So,
but a lot of people have it.
Yeah,
if
you are on a super high dose, that increases your chances. I'm not touching that. So,
you don't need it. If you need that high of a dose, then you're not trying to lose weight.
You do not need that high of a dose. Like a true diabetic, maybe, sure, maybe. But even them, they could manage their diet.
They're not changing their diet.
Right. So, but I'm not just cranking that out and going to raise that dose up.
Yep.
I'm not doing it.
Yep.
So the program is expensive for a reason. I'm evaluating
it's not
everything.
Though.
Well, they tell me some people tell me
if you're including the medication,
they love my price, and some people tell me that it's expensive.
That just means they can't afford it.
Yeah. So here's the deal.
It's expensive. $99 a week.
Whatever you want to call it, it's meant to
with the medication
help them find any root causes that could be hindering them, and teach them how to eat. Hopefully, I'm trying to get them to move and work out, and some people want the strict meal plan and a strict workout plan, and we do that. And some people don't, and we don't. So I'm not one way. I'm not like, it's this way. It's not.
Right.
Right? But the point is, I'm trying to work on them and teach them. So that way, when they are able to come off, they can still make the good choice. Now, sometimes are you going to be hungry? Are you going to crave something sometimes?
Being hungry is normal.
Yeah, so it's going to be okay. It's going to be okay.
I'm hungry right now.
I'm actually starving because we're making these videos during dinner time. But anyway, it's okay, right? Like it will be fine. You should be able to come off. And guess what? You're only going to lose 1 to 2 pounds of fat per week.
Right. Any more than that, and you're losing too much muscle.
Week. We don't want to see muscle loss. We don't.
Minimal muscle loss.
So the point is, GLP-1 agonists are they've had a bad rap. Is that how you say it, bad?
They're getting some bad press.
Bad press,
Bad
whatever.
press,
You know,
bad rap.
as old as I
They're a
am now,
perfect
it's like
tool.
words
They're-
just stop meaning things, and I create new words. But
I
and
think it's the
pronounce
greatest
them wrong.
thing since sliced bread.
But yeah, it's a great tool. People are like, oh, they're so bad. I'm like,
No,
what is so bad?
they're being used wrong.
About them. If they are being used wrong, anything can be used wrong. Anything. So if you have questions about GLP-1s or weight loss, because like I said, you do not have to do a GLP-1 agonist. You do not. I help people all the time with workout plans and diet plans and just getting overall healthy and what that looks like for them. Everybody has different goals. So you do not have to have the weight loss medication.
No.
You do not. But I do offer it. And I hate that it has a stigma around it, but that's because it's been done wrong. If it is done right, it is a very safe and effective tool.
Super safe.
Yeah.
And very effective.
Yeah.
And then you have tirzepatide, which is another option, which is Mounjaro. It's a little bit more expensive option.
Or is that bound?
Is that bound? Yeah. It's
GLP-1
the US version.
and GIP.
It's a GIP with the GLP.
So we have several different ones.
Yeah.
And we have a wealth of knowledge between us. We have a gym a couple blocks down the road.
Which the gym is included as part of the weight loss program.
The gym is included in the weight loss.
I don't know who else is doing that.
Yeah, so we're literally doing everything but going to the grocery store with you and buying your food and making it for you.
Yeah.
Like I would just.
I could do that.
I don't even cook. I'm not
That's
doing it. He's our cook. But
I'm going to charge for that.
yeah, for sure. I mean,
I'll
I
meal
can
prep
cook.
for you
I can.
for $1,000 a month.
We could start a meal prep company.
Oh, I just spoke it into existence. Jesus.
Or a supplement line.
Both.
But anyway, both. But okay, I think we're going to make this one super short.
Yeah, it's fine. So yeah, GLP-1s are
Wonderful.
They're a wonderful tool.
And they are meant to come off of. You should not use them for life.
Yep. Or you could periodically use them strategically.
Well, yes, you can use them strategically.
You can microdose them.
You can microdose
if you are
them.
in control of your diet,
Yes.
and you are in control of your lifestyle,
Right.
you don't need to be on a high dose. You use just enough that gives you that that edge.
There's no wrong way, right? Like
the wrong way
is too much.
to be on the
but
high
I'm saying,
dose
like, if you wanted to
and not-
microdose for, or if you wanted to come off and then it's like, try it again a little. You know what I'm saying?
Yeah.
Like, it's just a tool. Like,
it's a tool.
Whatever.
And it does help with insulin sensitivity and other things like that we've talked about. And
yeah, so it's not just making, like, people were losing weight because it's making them eat less, but it's also working on your insulin sensitivity and how you process the food you're eating, helps with that food noise. So they're a great and wonderful
right. When
tool.
you pair it with what you're doing,
Right.
with the whole rounded aspect of weight loss
Yeah.
and metabolic health
Yeah.
and restoring metabolic health,
Yep.
it's a great tool.
Yes.
By itself, I'm just going to take this drug and lose weight. That's a terrible way to approach it.
And
gonna
that's
be
why
bad.
we don't do it that way, and that's
We
why
don't do
the
it that way.
price reflects that.
Right.
So,
Yep. We don't just hand
so
out
if you
medic-
want, any more information on, weight loss, whether diet, exercise, whatever you want more information about GLP-1s, you can call the office, schedule an appointment, whatever, join the gym. You got a plethora of choices available, if you will.
If your goal is weight loss, you join here and you get the gym membership with it. You use the gym membership.
Mm-hmm.
You lose weight. You get healthier, and you love life.
Yay.
Basically.
Basically. That's it.
That's it.
That's it.